Hello, my name is Ashley Watts, and I am the Executive Director of York County All on Board Coalition, and I'm also a licensed addictions counselor. Today, we're doing a Good Samaritan training, and in this training, we're going to highlight prescription pill safety in order to prevent misuse of prescription pills. We're also going to talk about how we can all be a Good Samaritan for York County. Now, you might be wondering, why a Good Samaritan? Well, a Good Samaritan is a person who recognizes that a problem in our county is not someone else's problem. It's all of our problems. So we can come together to face this problem and hopefully help prevent prescription pill misuse. We know that when people misuse prescriptions, that it can lead to dependence, which can lead to an epidemic of overdose, which we've already seen in our nation and our county. So this is one way we as parents and citizens can prevent that from happening in our county. Now, as a parent, you might be wondering, well, what can I do to protect my family? How can I protect my family? Well, if you look at these pictures, you probably are like me, especially if you're a parent. You see these children playing with pills like they're candy and it makes you nervous. We do not want that to happen. And so one thing we can do as parents is just instill in our children good habits and practices when it comes to prescription drugs. So we want to make sure we keep our prescriptions locked away and out of the hands of our children and teens. It's important because, as you see that quote there, more than half of teens, 56%, indicate that it's easy for them to get prescription drugs from their parents' medicine cabinet. Might not be something we think about, but it is a way that they can access that, and we want to make sure that they have good, safe practices when it comes to medications, and we educate them and have conversations about good medication safety. So we're going to talk about that today and how you as a parent can have good habits and conversations around this with your children. So, first of all, we recognize that none of us wants our child to have to take a medication, whether it's every day, or frequently for a problem. But what we know is that sometimes medications are helpful. And so when they are taking a medication, we want to make sure that we're administering it safely. So the first thing I would recommend is to make it a habit that when you're administering medication to your child when they need it, based on their maturity level, you begin the conversation by talking to them about medication safety. So remind them when you're taking them to only take their medication from their parent or get designated caregiver or responsible adult in your family. Identify, I would only take medication from a nurse or a doctor or your dad or your mom. So be clear with each family who it is in that family that's the designated responsible person to administer medications. Reminding them not to take medication from other students, from classmates, or from other parents. You want to make sure that if they're in a game or a dance recital, that they're not taking medication from another parent or someone who is not their family's designated caregiver. It's very important to start that practice early in life so that they carry that with them later in life. The other thing you can do is model for them the appropriate way to talk to their doctor about medications. So if they're prescribed a medication, talk to the doctor. Take a few minutes and say, what's the dosage on this? What are the side effects that might happen? And how can I monitor those reactions? Also discuss with them if this medication doesn't work. When should I stop it? And proper disposal techniques. You never want to save a medication if you don't need all of it. Let's say the doctor says you don't need to take it anymore, or maybe the child had a reaction and didn't need it. Don't save that for other family members. We need to discard that as soon as possible. We also need to keep it in a locked bag or a locked case in our family household so that other people cannot get it. So for some of us, we might forget to take our medications, or if we've taken our medications. So maybe we leave it, I'm guilty of this, we leave it on the kitchen counter or on the breakfast table to remind ourselves. We want to be sure that we are not doing that in our families, because that gives people access to our medications, whether it's our family or children or other people who are coming in and out of our house. We want to make sure that those are in a safe place and not accessible to everyone. The next thing I want to give you a tip about is making sure that we are giving those medication dosages appropriately. Over 60% of overdoses happen because they're accidental. A person didn't realize that they were doing that. So we want to make sure, particularly with pain medications, we are administering them as they're prescribed and dosing them out at the times they're prescribed. So one thing you can do is get some sticky notes. We all have them, right, all over our house. And just on that sticky note at the beginning of the day, write the times that medication needs to be administered for you or your child or someone in your family. And then right beside that, you see I've done little boxes for check marks. So every time I give a medication, I make a check and initial it. And that way, if another parent or caregiver in the household, like I go to work and give it to the child's sleeping, and they wake up, they're not sure if they had it, they can just stick that to the bottle and they'll be able to see, oh, she's had her first dose and who gave it to her. And that way there's no confusion in a family. If you have several kids in your family, use a different color for each one. So, one is this color, one is another color, and that way you stick it to the bottle and you'll be able to keep up with that. That's a good practice also if someone's recovering from a surgery, not to allow them to administer their own medication. So your teen has their wisdom teeth out or a surgery, make sure that a parent is giving that medication and keeping it out of their access, because they might not be thinking very clearly and they may inadvertently take more than one dose. So we want to avoid that. Next, we have Lieutenant Mike Ligon. He was formerly of the Drug Enforcement Unit in York County, and he's going to share with us a little bit about his experiences with medications and why we need to be careful about them.
Hello, I'm Lieutenant Ligon with York County Sheriff's Office. I'm here to speak with you today in regards to pills and pill safety and things you need to know about prescription drugs as they pertain to young adults at this day and time in our society. Some of the things that we are seeing now with this is our young adults are now getting to a point to where they like to experiment not only with marijuana and things of that nature, which can be a gateway drug, but also dealing with prescription medications. Some of those medications being things like your Xanax and some of your Schedule II opiates like oxycodone and hydrocodone. Now, the way that some of this comes about is some young adults now, especially some of our young athletes, are having injuries. These injuries wind up having these young adults to have or sustain some type of surgery where they may be prescribed these scheduled medications. What we fail to realize is that prolonged use of these scheduled medications can cause a dependency in our young adult.
Lieutenant Ligon makes a great point when he talks about sport injuries. In fact, it's estimated that over 1.4 million injuries occur annually across 9 sports at the secondary school level. So we want to encourage our kids to be active in sports, to get out and exercise. It's healthy for them. But if an injury does occur, that's a time we want to be particularly careful in monitoring their medication use, especially when it comes to prescription pain medicine. We want to monitor when they're taking it, how often they're taking it, and also talk with your doctor about alternatives to medication. So maybe ice or physical therapy, stretching. Those are some things that the athletic trainer or a physical therapist can help your child with. So that's just a time we want to, their first experience with pain medicine is a time we want to be particularly careful about monitoring their prescription use and making sure that we discard of those they don't need to take. Now, when we are finished with our medications, one important thing that a lot of us maybe don't think about is safe medication disposal. So Keystone received a grant, and so they have thousands of these doTERRA drug medication disposal systems, and they are these bags that are very easy to use. They look like a Ziploc. You can see the picture there, and you can take these. We have them free. Call us, call the prevention department at 324-1800, or you can email me at allonboard at awatts@allonboard.org, and we will get you these. We will get them to your schools, to your neighborhood, to you, however you need them. We have plenty of them, and these bags are so easy to use. They're environmentally friendly, and once you put the medication in them, it deactivates them. So it's a safe way to dispose of them. Much preferred over flushing them down the toilet or coffee grounds. Those are not good for the environment and are not effective. So this denatures the drug and makes it safe. So you just open the top of the bag, add water, and add your pills in, then add a little bit of water, just halfway full, wait about 30 seconds, zip the top up and throw it in your trash at home. It's so easy to do. So we recommend clean out those medicine cabinets, get rid of those old pet medications or your old medications that you haven't used, and discard of those in a safe way. We also have drug take-back events twice a year, and you can follow our website for Keystone or All On Board, and you'll be able to see when those are. Those are free opportunities to do that. And Lieutenant Ligon's going to talk about a couple of locations you can do that every day that are a safe place to dispose of medications.
What we have to understand is that once we have taken our medication the way it is prescribed, and we are to a point to where we feel like we are healthy, we need to discard of those medications. Those can be discarded in the way of the pill drops that we have here set up in York County, which are set up in the municipalities and the law enforcement centers here in our jurisdiction.
I also want to mention before we move forward that there are some lock bags available. If you want to lock up those medications, Keystone has those. You can contact their prevention department and speak to Allison or Ashley Falcon about how to get those. So he mentioned the locations that you can do those. One thing that happens, though, that might happen, we hope doesn't happen to anyone, but does happen, is when people misuse prescription medications, there's an opportunity that they could begin to develop a dependence on those. And so while none of us really enjoys talking about substance use dependence, it is something that happens as our society. And one thing that prevents people from getting help before that dependence develops is stigma. And stigma is a negative belief that society holds about a group of people. And why stigma is harmful is it prevents people from talking about their illness. It causes people to feel ashamed of their illness or that their illness defines them. And it can prevent us from reaching out to offer support. It prevents the rest of us from doing that. So if we find out someone has diabetes or cancer, we're likely as a community to go in and support them, make them meals, offer to help them with groceries or do other things. But when it comes to substance use dependence, a lot of times people are oftentimes reluctant to reach out or help or support. And we want to encourage people to support each other in those times. Stigma keeps that from happening. So how do I recognize if I have a stigma about substance use disorders? Well, the way that I can do that is look at my wording. So many of us maybe grew up in movies or seeing on TV or maybe hearing in our household certain terms that we now know could actually increase stigma. So to reduce stigma, we want to use words that don't have that kind of moral kind of judgment associated with them. So instead of calling someone an addict, a junkie, or a druggie, what we would like to do is call someone a person with a substance use disorder or categorize them that way. So their illness does not define them, it's just a part of who they are. Instead of using words like a person is dirty, we want to use words like actively using. And for somebody who was a former addict, we want to refer to them as a person in recovery. So those terms are more inclusive, and it takes some of that reluctance for people to identify with that out of that. So that's one way we can all do that. Now, unfortunately, if a person does misuse substances, prescription medications, or illegal medications that they receive illicitly, that is something that could lead to a disorder, a substance use disorder. And I just want to acknowledge that substance use and disorders they're complicated. It takes a lot of understanding to diagnose or to determine. So what we want you to do is if you have a family member or somebody you care about, your child who you're concerned about, have a professional assess them to determine if they do have a substance use disorder. Oftentimes, if we question it, there's probably an issue there that we could actually intervene from. So I want to encourage you to reach out and do that. But addiction is a disease. It is an illness. It is categorized in the American Medical Association as a disease or an illness. And what we know about it is it's treatable. That's the best news about it, is that if a person reaches out to get treatment, we know that millions of people have found recovery and their life is very fulfilling if they receive treatment for their substance use disorder. But it is chronic. So if a person continues to use without help, intervention, or treatment, they will get worse and it can be fatal. It is a complex disease that involves our brain, our cognitions, our genetics, our environment. So we want to get help for that. Don't think we can beat it on our own. We want to reach out to others to get help. So that's why it's so important that we as parents start these healthy practices and habits around prescription use early in our children, and that safety gets taught to them early so that we can prevent that.
Okay, so you just finished hearing from Ashley Watts about all kinds of stuff. My name is Allison Huray, and I am the Student Assistance Program Coordinator at Keystone. And I'm going to go a little more into depth about why this is a problem. But first, we're going to hear from a parent about why it's important to talk to your youth about, prescription pill safety.
It's so important as a parent to talk to your children, even at a young age, even though you may not have seen any signs yet, to just talk to them about maybe their friends or what they're witnessing at school. So many times we don't even know, that they are witnessing this or that they do have friends who are in this situation. So it's very important.
Okay, so now that we've kind of heard that, we're going to talk about why we're talking about this. And I'm sure you've heard lots of words about pandemic, but we're actually in what we call an opioid epidemic, which is slightly different. Now, this epidemic has been going on for a long time, so we're just going to kind of go through the background of what's gone on with it really quickly. So there's been 4 waves. Wave 1 started in the 90s with doctors overprescribing these prescription pain pills for people. You know, they say, hey, let's rate your pain on a scale of 1 to 10. You go in there, and their goal is to get you to feel no pain. So they started giving medications out. However, they didn't know that these medications could become addictive to certain people, just depending on, like Ashley talked about, genetics, environmental factors, all kinds of different things. So that was wave 1, which was in the 90s. Wave 2 started about 2010, and we saw a rapid increase in overdose of heroin. And you're probably thinking, how in the world did we jump from, prescriptions to heroin? Well, it's actually not that far of a leap when we look at it with kind of the makeup of things. So prescription painkillers and opioids are the same kind of drug category as heroin. Heroin is an opioid. So when the doctors realized they had made a mistake and they didn't need to be giving people all these prescriptions that could potentially be addictive, they started to pull back and they started to say, hey, no, let's not give as many pills out and let's, monitor this. But people were still already used to what their pills were making them feel. So they turned to the next thing, which was heroin, because it still fell in that opioid category. So if we fast forward a little bit more to wave 3, which began around 2013, we see a significant increase in the overdoses involving synthetic opioids, which is that fentanyl I'm sure you've heard about in the news. And the synthetic opioid, all that is, it's an opioid that's not naturally occurring. It's made in a lab. So that's what fentanyl is. And then we're currently in the 4th wave of this epidemic, which is polysubstance use, which is just a big term. They basically say multi-substance use, so more than one drug being used at a time. So the example they give you here is like painkillers with opioids and meth, which is a stimulant, being used on top of it, and talking about, those pressed pills that you might have heard about in the news as well that contain things that people don't even realize, which we'll get into in a little while. So when we talk about opioids, we understand that not everyone, knows what an opioid is or understands that terminology. So we're just going to give you a little bit of understanding of that. Opioids are made from the opium poppy plant. It's a plant, they make the pills from it, and that's how we get our medications. And they are legal most of the time when we have like Vicodin, morphine, codeine. Even fentanyl is legal and is given to very specific patients with very serious injuries or illnesses. And then an opioid is also heroin, falls into that, but that's obviously the illegal one. And why these pills work is they bind to the receptors that are all over our brain and body. So when you take it, it binds to it and says like, hey, you're not going to feel this pain anymore. But it can also regulate that pleasure sensation as well, saying, hey, you don't feel pain, but you're going to feel good. And that's why they can have that addictive component in them. And there's all different forms of how they're used: swallowed, snorted, smoked, injected, patches. It just depends. And like we talked about a little bit earlier, the synthetic opioids are the ones that are manufactured in a lab setting, which is that fentanyl, that methadone, things like that. So we have this slide up here to talk about commonly prescribed opioids, because it's very important that if you are taking an opioid, that you're aware of it. And most of the time, if you go to like a CVS or a pharmacy and you get your medications, they're going to tell you that it's an opioid, and they're going to, ask for ID and make sure you're of age to have it, and tell you about any kind of, pills that you shouldn't take with it. However, if you're not the one picking up your prescription, or if you're picking up someone else's prescription, like I know I go pick up my grandma's prescription for her, if I'm not relaying that information to her, she's not going to know that this is an opioid. So we just kind of like to put these on here so that people are aware that they are commonly given to certain people. So some of the ones like Dilaudid, hydrocodone, oxycodone, Oxycontin, Vicodin, roxicodone, Percocets. Those are all very common kind of terms that we hear with prescriptions. And we just want to make sure people are aware this is what you're taking. So along with that, we always say, make sure you're getting your prescriptions from the CVS, from a pharmacy, from a doctor. We don't want you going out. Even if you're in a setting with people and they're like, oh, I have that same medication. You forgot yours, you could have mine. We don't want to do that. The prescriptions are very individualized. They're for you. They're for your weight, your height, your age, your other medications. We don't want to be sharing those. And we also, if you run out, maybe you took too many or you lost some, you don't want to be finding someone to sell you some on the street or anything like that, because they're often mixed and you're often getting things you don't even realize, which kind of goes along with the influx of overdoses we saw. So especially in York County, we've seen that stimulants like Xanax and other things are being marketed as that, but really they're being mixed with fentanyl and things, and that's why we're having a spike of overdoses. So when we talk about that fentanyl that, is all over the news these days, we just want to give you an example of what a lethal dose looks like. So you can see a fatal dose of heroin is about 30 milligrams, right? But a lethal dose of fentanyl is only 3 milligrams. So a lot less. And you can see it in comparison to the penny, how small that is. And that's a lethal dose. So if someone gets that, they could potentially pass away due to having too much fentanyl in their system. And this is what's being pressed in some of those pills, which we have a picture of right here. So you can see the real versus the fake, and they're very hard to tell the difference. We've had drug enforcement officers tell us, like, we don't know. We just take them off the streets and wait for the lab to tell us if it's a real pill or if it's, one of these pressed counterfeit pills. So people don't know what they're getting. To me, the fake one just looks like it was at the bottom of like the packaging for a long time and it kind of got rubbed a little bit. So I would never know. And these are very dangerous because people are taking it thinking it's one thing, but really they're getting something completely different that maybe their bodies aren't used to or they could potentially overdose on. And these are coming, over from Mexico. They're coming from China, all kinds of different places. So now we're going to talk about what puts someone at risk for an overdose. And there's a lot of stigma, like Ashley talked about overdose. But overdose really can happen to anyone taking anything. Okay, it's just getting too much of something in our bodies. So misuse, not taking them as prescribed, taking too many, accidentally taking more than one. Exposure to fentanyl, if you're not getting them from where you should be. Previous overdoses indicate there could be a potential another one if you have a lowered tolerance and if you're mixing drugs. So there's reasons that labels say you can't mix these two together. The pharmacy should tell you if certain things don't go together, but also on the bottle you need to read what you can and can't do. Can't operate machinery, can't drink alcohol with it, and making sure we have that and that knowledge behind us. Now, we hope it never happens to anyone, but we just need to be aware of the signs of an overdose because it can happen. If you don't have the sticky notes like Ashley talked about and, someone takes more than they were supposed to because they didn't realize, like she said, most overdoses are accidental. We want you to be aware of the signs. So if they're unresponsive or have very slow breathing or they're not breathing, they have very small pupils, blue lips or blue fingertips is all the kind of physical signs. If there's evidence of any kind of opioid use around, so if there's pill bottles, if you know they're on a prescription, if you see, needle marks in their arms, any kind of drug paraphernalia, that's a sign. And you can get Narcan or naloxone, but this is only to be used on people with depressed respiratory problems, not mental state. If it's a mental state, like they're kind of nodding off, that could just be what their high is like, and we don't want to give them Narcan at that point. Narcan is only effective on opioids. It does not affect benzos like Xanax, Valium, alcohol, cocaine, meth. However, if it is, it's maybe not a prescription Xanax, it could be something they got from somebody. It's always safer to try the Narcan. Narcan will not harm anyone. If you use it and it doesn't work, it's still better to use it and have tried something than have just stood by and not done anything. So now we're going to watch a really quick video just about the signs of what an overdose could potentially look like.
Here are some signs of a possible overdose. It's hard to wake the person up, or they seem overly sleepy or confused. Their breathing has slowed or stopped. Their pupils are the size of pinpoints. Their lips or fingernails are blue.
Okay, so like I said, we hope no one ever has to deal with that situation. But according to the U.S. Surgeon General, we're more likely to administer Narcan these days than CPR, which is a scary fact. But that's why we tell people it's great to have it in your first aid kit, have it in your car, because you never know when you could potentially be helping someone and being that good Samaritan like we're talking about. So what is Narcan if you haven't heard of it? It is an opioid overdose reversal, so it blocks those receptors that take on that kind of pain relieving thing and cut them out so that the person the drug is no longer working in their bodies and you can reverse that overdose. If you do or need some or interested in getting some, Keystone gives it away for free, no questions asked. You just call our phone number, you show up, you say, hey, I need this, we'll give them to you, and you can go on your way. So now we're going to see a parent and talk about why she thinks it's so important to have Narcan around.
If ever your child has had a surgery, Narcan should be in your first aid kit. You never need to think that you may not need it. It's better to have it and not need it than to not have it and need it. If ever your child has had a surgery,
So like she said, if you've had any kind of surgery or anything like that, people's bodies react very different to different kinds of medication. So it's always best to have it around in case you do need it. We don't want you to have to use it, but just in case. And the Good Samaritan laws in South Carolina do protect people from any kind of criminal charges, anything like that, if you decide that you are going to help a person that you believe is having a potential overdose. You are safe, and we'll talk about the steps of how you handle that next. So let's say that unfortunately you're in this situation, someone you know is overdosing, or you see someone that's potentially overdosing. What are you going to do? You have your Narcan. First step is always call 911. Okay, the ambulance will come. They will have more Narcan than you will have, and they'll have more resources to get the person the help they need. So that's always step one. Step two is when you get your Narcan, you're going to place it right under the subject's nostril. Okay. It's kind of like doing those nasal sprays that are uncomfortable, but that's exactly what you want to do. And you do not want to test it because there's only one dose in here and you don't want to waste it just on the air. So you place it right under the person's nostril and you push up and squeeze the entire contents of the bottom up into their nose. Okay. Once you've squeezed the entire thing out, you turn them to their left side and you wait. You wait for approximately 2 minutes. And if they do not wake up, then you take your other one because they come 2 in a box. And you do it in the other nostril, and you wait again. And hopefully by then the ambulance is there. They'll have more because it can take, depending on what drug it is, depending on the person's history and tolerance level, it can take 2 or more to bring this person back. Okay, so always kind of follow those steps and just know it's better to try it because this will not hurt anybody. Okay? If I did it now, it's not going to hurt me. It's not going to get me high. It's not going to do anything. Okay. So now we're going to kind of see a video about the steps and someone putting those steps into place.
911 immediately. Then administer the naloxone, also called Narcan nasal spray. Remember, naloxone only works on opioids. It will not treat an overdose from sedating medications such as benzodiazepines, which include Valium, Klonopin, Ativan, and Xanax. Start by moving the person to their back, then follow the 3 P's: peel, place, and press. Take the spray out of the box and peel back the corner tab to open. Hold the spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Tilt the person's head back and support their neck with your hand. Gently place the tip of the nozzle into either nostril until your fingers are against the bottom of their nose. Press the plunger firmly and all the way to give the entire dose. There is only one dose, so do not test it first. Then roll the person to their left side. If they do not wake up in 2 or 3 minutes, administer a second dose of naloxone. Stay near them until emergency medical help arrives. Contact your local pharmacy to find the most convenient location to purchase naloxone. More detailed instructions on how to use naloxone can be found inside the package. Preventing deaths caused by opioid overdose starts with all of us. We share the responsibility of safe care for everyone in our community.
Okay, so once again, like I've been saying, we hope no one ever has to be in that situation. But now you know what to do if you ever are. Ashley talked earlier about safe storage and keeping pills locked away. And if you want lock bags for your medication, to reach out to us, we can get you some. We also want to talk about not having loose pills around. So I know even my family members are bad at, oh, what's the matter? You got a headache? Like your stomach hurts, hang on, and pulls out just a baggie of all kinds of random pills. And you're like, how do you know what's what? And they're like, oh, I know. We want to make sure we don't do that. We keep them in the actual medicine bottle so people know the exact dose they can take. They know what the side effects are and things like that. And always secure them after use. So making sure we keep them, where they're supposed to be and not kind of intermixing them. If it's in a cabinet, if it's above the cabinet, anything like that. And then keeping track of quantities. She showed you the sticky note with times, but also keeping track of, how many pills you've had in there. That way you can remember, okay, if I had 4 pills this morning and now I have 3, I must have taken 1. Or making sure if I know I didn't, who else would have gotten their hands on them, and kind of figuring out that situation. Especially if you have more than one person taking medications in the house, They all come in the exact same orange bottle most of the time. So making sure we have those separated so that we know I'm not taking someone else's medication completely by accident because that's where I thought I left mine. So we can all be good Samaritans. We just have to voluntarily help someone else who's in distress. So just, making sure that we keep others safe and we keep our families safe when it comes to the prescription pills and any kind of prescription medication. So Keystone has all kinds of resources, and if you need any information about any of this, you need to, figure out where you can drop off medications, you need some of those bags, you need some Narcan, just reach out to us. You can call the number at the bottom and ask for prevention, and we can answer any questions you have or figure out how we can get you the resources you might need.